Dr. Rakhi Dcruz, our dynamic speaker, who's a consultant surgeon at Chaitanya Institute, Kollam, for the topic Mindset Mastery, Delivering Bad News, Staying Calm to Surgical Complication. Over to you, Dr. Rakhi.
Thank you. So, good morning, everyone. I'm Dr. Rakhi, and I'll be talking on how to deliver bad news and staying calm through surgical complications in your initial period of your career. So, practicing ophthalmology is exhilarating and fulfilling when you're able to help the patients recover their vision. But there will be times when you need to tell your patient some negative information about their prognosis or about their surgery. So, are we really prepared to be the bearer of this bad news? So, I think nowadays there are a lot of legal cases going on with surgeons. This has become because the people feel like we are money buggers. And also, I think one of the major problem here is the young surgeons lack communication skills like the older surgeons. So we need to upgrade our communication skills with the patient. And most of these things can be cured if we have a proper preoperative chair time. A good preoperative counseling can save us from a lot of issues. So whenever you are taking up challenging cases, or maybe it is just a regular case also, just try to detail about all the possible complications, giving small examples. You see, 5 in 10, 100 patients can have this. A 2% of patients can have this, like this. But try to tell what are complications that can happen in your initial period of career, however confident you are. But after counseling, you don't need to scare them off also, right? So reassure them by explaining that this is just a common set of complications that we explain as a common standard protocol to all the patients, because we are not gods, right? And we cannot predict every outcome. However, as a doctor, you are confident and you can guarantee to give your utmost best care to this patient. So if you can convert this to Malayalam and tell this to every patient, you are saved. Second, the complication has happened. So you need to prepare first before breaking the bad news. First, know your patient's background, their support system, who is going to take care of them, their financial system. Consider the emotional state, educational background, and their level of understanding. When you are delivering the bad news, you should maintain a confident body language, maintain proper eye contact. You should not be having any nervous gestures, and be very assertive while talking. So there are a set of protocols that are being set up by doctors itself. This is a SPIKES protocol set up by the doctors in the oncological field, which stands for setting, perception, invitation, knowledge, emotion, and strategy. Setting means you need to find a comfortable time, a private warm space, set the meeting with your patient and bystander. It's not necessary to rush the news like dropping a bomb. First, take a moment or two to connect with the patient and as well as with the bystanders. Whether we understand it or not, this decision is going to change the patient's life. Perception refers to the patient's current level of knowledge and assess whether the patient already knows or suspects by overhear something from the OT. Invitation is asking the patient if they want to hear the detail about the situation. If they want, you can explain. If they don't want, don't force them. Never over-explain. Knowledge is your own knowledge on how to share the news clearly as well as compassionately. Avoid using vague languages and lot of medical languages because this can create confusion. Emotions is acknowledging the valid and validating the patient's feeling. Create a space for the patient to express their emotions, and for this you need to practice deep empathy. Put yourself in their shoes first, identify their reaction. It can be sadness, it can be anger, it can be shock, it can be denial. But help them in identifying that too. Now, come up with the last segment, strategy. Discuss the next steps and the care plans. After delivering the bad news, offer the steps or support that you can help to ease the tension. It shows that you care and you are willing to help. Come up with the follow-up plan of what all surgeries that might be required further, what is the financial needs that might be there, and what are the aids that you are going to provide. So, staying calm through surgical complications is the second part. Complications, as we all know, are inevitable. We evolve and learn from our mistakes and complications. But then what to do when you have 4 complications, especially in your initial period? First of all, accept the complication. Stop denying. So this has happened to me also in the initial period. I know my gut feeling says I made a PC run, but still I'll be thinking, no, I don't think there is a PC run. Let me just put the IOL and see. So now I have stopped that. Yes, now I accept I made a complication. Everybody does. Great surgeons also have complications. But I am going to handle it in the best way possible by myself. Be mindful of the situation, concentrate, compose, stop being anxious. Give yourself a minute or two. Take few deep breaths. Think of a recovery plan. This will minimize further mistakes or iatrogenic complications from your side. Never abandon these patients and be very empathetic and considerate to their situation and get help from your colleagues. Maybe you can get a help from your VR colleague to do the best for this patient. So staying calm through complications is very easy to say, but it's not that easy when it comes to real life, right? So for this, you need to practice something. You need to practice breathing techniques, practice mindfulness or yoga. You need to control your emotion. So I will just take a minute more. So here, how to practice mindfulness, especially in your OT days. What you can do is in the morning or just before the OT, just spare 5 to 10 minutes for this. Take a comfortable seat wherever you can find a comfortable seat. You don't need to have a very comfy seat and all. Maybe it's just your regular consultant seat is also fine. But set a time limit. Nobody else should enter during that time. Notice your body. Just be calm. Concentrate on your breathing, on your inhalation and exhalation. And in between, the mind keep wandering. But whatever it is, be kind to that wandering mind and try to bring it back. Just do this. Concentrate only on your breathing and nothing else. For 5 to 10 minutes, your mind will calm down. Just before your OT, you will be having a very stress-free mind. And this is the last slide, and this happens to the new surgeons. They get caught in the spider web of complication. And why does this happen? Just remember, whatever complication has happened, you have your next cases waiting for you. You cannot abandon them. Compose yourself. After you finish that complicated case, stop thinking about what has gone wrong. Remember, you can't change anything by blaming yourself for being guilty. What has happened has happened. You need to refocus. Give your 100% concentration in your next case. Get your mind back in your OT. After the OT, try to find out what went wrong. Discuss with supportive colleagues or seniors what you could have done better. So this is the right way to go about with complications. Thank you.
Thank you, Dr. Rakhi, for those wonderful